Alright, welcome to the first episode of the Malaysian Counsellor. My name is Kalim Maindan and I'm joined today by Brian Kueh, who's a clinical psychologist. Brian, could you please introduce yourself a little?
Okay, alright. Thank you, Kalai. Okay, so hi everyone. My name is Brian. I'm a clinical psychologist. This is my third year of practice lah. Besides that, I was also previously a behaviour therapist as well, mainly specializing in the special needs field, working with children with autism, ADHD. But now primarily I'm a clinical psychologist with my own center, which I specialize in providing consultations, assessment for children with special needs. And I also help to oversee some early intervention programs. Yeah, that's mainly what I want to talk about myself. Yeah.
Alright, thanks Brian. So I have Brian here today because there were some general topics I wanted to cover related to mental health, because Brian is a clinical psychologist and I'm a counselor and we do clinical work on the ground, and we were hoping that by the end of today's episode we could help people sort of have an idea of what facilities are available for someone who's looking to take care of their mental health or get treatment, and who are the general practitioners. We talk about mainly psychiatrists, counselors and clinical psychologists. Who are these people and what are the differences, and maybe a little bit about how this whole system sort of functions. Before all of that, let's just get one thing down lah. Brian, just sort of help our listeners understand what is mental health when we talk about it.
Okay. I think in the current generation, especially right now, it's 2026. A lot of people might think like mental health, it sounds like a very woke thing, the in trending you talk about. But if you really think about it, right, it's something that we've always had. It's not something that just appeared out of nowhere. But if we just want to strip away all these clinical fancy jargons and whatsoever, mental health is just simply about our emotional, psychological, and social well-being. Imagine it as this invincible engine behind you that's kind of helping you in terms of how you think, feel, act, and handle the world. Okay. And I specifically mentioned these three things because it's the three pillars of mental health. Okay. If we really just want to compartmentalize mental health, right, there's three dimensions.
Okay.
Our behavior, our emotion, and our cognition, our thought. So basically, if you're going for mental health services, what you're trying to hope for is a change or an improvement in one of these three pillars. But there's also another thing about, I wouldn't say it's just about mental health, but it's this idea about health in itself. So let's just talk about physical health. Physical health is not just about, not being sick, not having a disease, not having a disorder. You can be disease or cancer free, but also not fit. You're not able to climb stairs, you're not able to run, and whatsoever. So the same thing is for mental health. Mental health is not just about, not having a mental disorder, not having a mental illness. It's also about whether, how are you burnt out from your work? Are you experiencing some kind of grief? How are you flourishing with life? So it's not a binary yes or no question. You're not healthy or not healthy, or you have a disorder or not having a disorder. Mental health is the same. It lies on a continuous spectrum. How are you? Are you flourishing? Are you coping? Are you neutral? Or you're starting to struggle a little bit, or maybe you're probably on the other end, which is a little bit more severe, where you probably are a little bit more disabled in the sense that you might have some issues with your emotional and also social functioning. So it's about this entire spectrum and not just a yes or no kind of question.
I understand. Okay, so when we talk about mental health, we need to look at the multiple aspects of it, like you mentioned, behavior, emotions, and even what's the last one, right?
Cognition.
Cognition, right? So behavior is basically what we can observe, right? Cognition is our functioning of our brain, to put in like a very simple term, and then emotions is things and how we handle that part of what we go through
That's the gist of it.
Gist of it, right? So, but how did come into this whole yes or no binary mindset? How is it that the general population sort of looks at it that way?
It's a rather interesting phenomenon, and it kind of falls into one of the issues in what we call cognitive behavioral therapy, which is one of the more, I would say, mainstream or gold standard treatment in mental health and psychotherapy.
Mm.
In cognitive behavioral therapy, we try to identify what we call cognitive biases or errors. So one of the cognitive bias is called black and white thinking, or all or nothing thinking.
Okay.
That's how we generally humans tend to struggle psychologically as well. We think either or I have to go for this or don't go for that, or he hates me or he likes me. But there's actually a lot of middle ground to cover lah. So the issue with black and white thinking is that we think that there's only two options. So the same thing kind of applies in this health idea as well. We fall into this black and white thinking is either we have a disease or not have a disease. But there's actually something in between as well. You can not have a disease but not really be very healthy. And some people, if I add in the spectrum and dimension of mental health, just because you're physically healthy, some people might not be psychologically healthy. Some people might actually, people who are on their deathbed, actually there's a lot of research to say that they have the highest life satisfaction. So they, in a sense, they probably have, been through a lot, and also they probably done what they want to do already. But of course, I'm not saying that applies for everyone now. So ideally, we want both physical and mental health. But if I want to pinpoint this specifically to mental health itself, right? It's not just about this all or nothing thinking that's leading to this binary thinking. But I think in Malaysia or Asian culture especially, the idea about mental health is definitely always being linked and associated to mental illness. You're like, oh, mental health, you gila, you're crazy. So, like I said, just because you have a mental disorder doesn't mean you're crazy as well. So when we're talking about mental health, it's not really just about the crazy or not crazy spectrum. There's a lot of middle grounds to work with as well.
Okay. And how do you think we can sort of better help people come out of the binary side of thinking? Because even you mentioned just now, just because you might have mental health disorder doesn't mean you're crazy, right, per se. Let's talk about layman terms, right? So how do we get people to sort of better understand the cognitive bias that they have?
Okay, so here's a question to ask yourself as well. When there's nothing wrong with your life right now, nothing dramatic, nothing too extreme, how are you feeling? Are you feeling just neutral, meh? Or are you genuinely satisfied and happy with how things are going? Okay, and wherever your answer lies, there's no right or wrong. But it's more about, if you feel neutral, that's totally fine as well. But do you think you can do something more to make things a little bit happy or a little bit more satisfying per se? Because I'm not saying that your life needs to be happy 24/7 as well. And the most simple thing that we can do right now is think about not this binary system, but just splitting it into three ends: good, neutral, and bad. That's how I like to look at things. Okay. It's not always just about the positive and negative. It's about the positive, neutral, and negative. Okay. And generally speaking, we should be in a neutral state most of the time. Okay. Because that's how things are. If you are somebody who's in a sad or, in a sense, negative state most of the time, right, I would actually be concerned whether you have some kind of mental illness or mental health disorder. But there's also on the other end, if you're always happy all the time, do you think culturally or socially you will be okay if you see somebody who's smiling, laughing all the time? You also feel like there's something a little bit weird, right?
Something's off.
Yes, exactly. And I think some people have even used the word bipolar, but that's definitely not bipolar. That's definitely something of a different issue. But this is this idea that we generally think that if you're not feeling good, then you're definitely on the negative end of things. That means you're not happy. Not necessarily. Okay, just because you're not happy doesn't mean you are sad. You can be in the neutral state. So actually being able to sit and maintain a longer neutral state, right, is this idea about how mental health should be.
Wow, Brian, thank you for that explanation. I do not know who's not going to understand that. So, but thanks for breaking it down into the point that I can see that, just because you're not happy doesn't mean you're sad. And then the vice versa as well. There's sort of this middle place which is a general good place to be based on what I've seen outside of our practice, right? Culturally, a lot of people who follow spiritual teachings sort of associate that with like meditation, getting into this neutral state of mind, which has historically shown to help a lot of people. But yeah, thank you so much for that explanation. Like we can talk about that a lot more, like in like future episodes. Alright, so let's talk about someone who is maybe going through mental health difficulties or possibly a mental illness, right? I need help. Now, what are my options? Now we're talking about Malaysia, we're talking about our country. Where do I go if I'm a Malaysian?
Okay, so I'll break this down into two components.
Okay.
There's the where do you go and who do you look for.
Okay.
So starting from the where do you go, right? Generally speaking, I think it's safe to say you can break it down into three big categories. Number one is the private setting. Number two is definitely public government setting, and number three actually NGOs. And I would say a large degree of mental health services is being run and maintained by NGOs as well, which is whether to say a fortunate or unfortunate thing, but it's something that I think is a silver lining in Malaysia. Why am I saying that? Is because let's talk about the first and main thing about our healthcare service first. So most Malaysians know about how our healthcare service is. In Malaysia, I think we are very fortunate. We have a very, very good subsidized public healthcare service. But of course, with such a low rate, it comes with a big problem, which is the entire workflow and turnover. Turnover not just is in our doctors, but the amount of people that are in our clinical psychiatrists and in our government hospitals daily, it's astronomical. But that doesn't mean it's a bad service. Especially like I said, one of the key proponents about why you should go for public or government mental health service is because if you feel like finances is a huge concern for you. And it's easily accessible, and even I'm not sure when it started, but I also just read up about this news, I think in the past year, where I think everybody knows our MySejahtera app. So it was like our best friend in COVID. So they've actually transitioned it into some kind of healthcare app per se. And you can actually go down and scroll for a mental health screening test at the bottom, which is the DAS 21. And then you click into it, you just fill it in, and then they'll actually help you like create a chain referral to the clinical psychiatrist. So that's one of the most simplest ways to first get some kind of referral to mental health services. Actually going to the KK or even going for that with
screening.
I think they call it Ujian Saringan on that MySejahtera app. And then by there, they will actually help take a look and see like, okay, do you need a counselor, or do you need a psychiatrist, do you need a clinical psychologist? They may help to make that referral. So I basically helped identify the who just now. I'll elaborate a little bit about that later on. So that's generally how the public health service would work. Then the second is actually private services, private mental health services, which we generally call the psychological centers or the counseling centers. And I would say they take up a huge bulk of the mental health service in Malaysia. It's a bit of an unfortunate situation because it's more about it increases a lot of accessibility, but of course cost is a lot higher per se. I can give a rough estimation. A session with a counselor or clinical psychologist for about a 45-minute to 1 hour session can easily cost about 200 ringgit. So it's not something that's easily accessible by a lot of people. But those who are maybe in the M40, T20 kind of range, maybe that's something you can try to look for, and you're something that you can afford. You can only just search up, okay, what's the nearest psychological center near me? What's the nearest counseling center near me? And you probably can get quite a few number, especially those who are staying in the KLPJ area. So then there's the last one, which is I would say a little bit of a middle ground in the best of both worlds per se, which is NGOs. So just to name a few, like the Malaysian Mental Health Association, MMHA, MIASA, these are organizations that actually have been running a lot of charity work, and then they've been building quite a huge fund to actually give very affordable or subsidized services to people who require mental health services. They won't be as cheap as the government sector, but they definitely won't be as expensive as the private sectors as well. And one thing that probably is a caveat is about the availability per se. Maybe the waiting list is slightly longer than private settings, but it will definitely be shorter than the government settings, because in government settings, right, some psychiatric appointments, just getting the appointment could easily take up to half a year to a year. So these are NGOs, and these NGOs, right, more often than not, they're actually collaborating with some of the university or the government hospitals already. Like the government hospitals, they know that maybe the waiting list is a little bit long, and then they feel like this patient or this client probably requires a little bit more critical care, and they already work together with organizations such as MMHA, MIASA, and then they'll just drop the referral just like that. Or can you help see this patient, or this patient you can go over there. And some private clinics or private psychological centers do that as well lah. So yeah, that would be, I would say, the big three of where to go per se lah.
Alright, okay.
Yeah. So now coming into the big three of who to look for.
Yeah.
And these big three are often confused lah. So I'll just try to repeat the three professions again.
Yeah.
One is a counselor.
Yeah.
The second is a clinical psychologist. Third is a psychiatrist. Okay, there's the word psy or cow or whatsoever. It makes a lot of people confused.
Yeah,
but
and this is my favorite part of the episode, so
Yeah.
let's dig into it.
Right. And I will just give like a general briefing and elaboration of what's the difference between these three professions.
Okay.
So a psychiatrist is a medical doctor. They studied medicine, they went through their specialization training, and are very well versed in the biomedical model and the medical management towards mental illnesses. And it's not just about the medical management as well. So these psychiatrists, they're also trained in psychotherapy as well. But predominantly, they are trained under the medical management. So what does that mean? They are individuals, they are medical professionals, they can prescribe medication for mental health conditions.
Okay.
Okay, then the second one, a clinical psychologist like myself, was usually somebody who did a 3-year or 4-year psychology degree and continued doing a 2-year master's in clinical psychology. In overseas, some countries, they actually don't just require a master's, they actually require a doctorate or PhD. So we are not doctors, we are psychologists, but we are also medical professions that we are also trained in psychological testing, clinical diagnosis, assessment, and also providing psychotherapy. But the main difference between us and a psychiatrist is we cannot prescribe medication. Okay. But it is quite common in hospitals for a clinical psychologist and a psychiatrist to be working together in a team.
Okay.
And that brings us to our counselor, like Counsellor himself. Okay. A counselor is usually somebody who actually did a bachelor's degree in guidance and counselling, a 4-year course, or maybe a 2-year master's in counselling. Okay. So they're usually more focused on guidance, talk therapy for, I would say, general life stresses, grief, relationships, coping strategies, and life transitions. But generally speaking, counselors cannot prescribe medication as well, and they are not trained in very specific psychological assessment or diagnosis, but they can do general mental health screening and assessments as well. Okay, this comes to the part where I often get a little bit uncomfortable talking about the differences because people like to think of this as if there's some kind of hierarchy. Just like right now, I'm actually pointing my hands in a triangle. Like at the top is like, psychiatrists, they're doctors, they're the fancy people. So they can do therapy and prescribe medication. So they're the top.
You don't need anyone else.
And then the clinical psychologists, the ones in the middle. And then, they're like the middle child who tend to be forgotten as well.
That's true.
We can actually assess, but we cannot prescribe medication. Then after that, the counselors are the ones that, they cannot prescribe medication, they cannot assess or diagnose diagnoses, but they are the ones that are a little bit more accessible per se. And they're definitely more counselors than clinical psychologists. And I'm not really sure about the number of clinical psychologists and psychiatrists right now, but I would say clinical psychologists are quite on the rise. But as I said, it's not about a hierarchy. Like each one of us has our role and a responsibility. And it's about making sure that we maximize our role for the patient or the client. There are certain patients that may require medication that definitely a psychiatrist has to be involved. Some patients, maybe they're a little bit more facing towards the life transition side of things, and they can always go reach out for a counselor. But the most important thing is, whichever profession you're looking for, they are able to assess whether your condition requires more help. For example, you really need medication, they'll make a referral towards a psychiatrist. Or you're like, okay, a psychiatrist look at your condition and okay, I can prescribe you the medication, but I think maybe you might need to see somebody on a more regular basis, maybe a weekly basis. You should go see a clinical psychologist, you should go see a counselor. So it's about working together in a team. It's not an isolated environment per se. Just like how in a hospital, a doctor cannot work alone. Okay, a surgeon cannot work alone in the operating theatre. they need their assistants, they need the anesthesiologist. Some people argue are more important.
And
and also the nurses
here, right?
so nurses and everything. But even a surgeon cannot operate alone or do work alone in a surgical theatre. The same thing with any other patient or client. We cannot work alone.
Okay. Brian, thanks for breaking that down. I think before we started recording, we were talking a bit about how can we help people understand this better. And I think over the years that I've known you, this is something I've even brought up even in casual conversations. Like me personally, I have a lot of respect for CPs. Why is it when we have CPs, do we really need counselors? Or a psychiatrist maybe not as important. We're dishing out a lot of things to the psychiatrist because there isn't psychiatrist here, but no offense intended. Anyways, but I'm glad that you actually managed to help clear that up, because when we look at my perspective of it, at least, is like, if those positions were not there, why do each of these have different licenses? Why do each of them have very specialized training, and each one has different board that regulates its practices, regulates its licensings, and so on and so forth. So I'm hoping that our listeners do get to understand the differences better, because even when I was as early as an intern, I would have people refer to me as, go talk to this doctor, counselor person, and while it's flattering, it sounds flattering, like it's a lot of work to sort of clarify. So that's why I kind of wanted to spend at least a bit of time on differentiating the three roles and why it's all important. But I think we can actually even spend a whole episode like breaking down even more.
Yeah, definitely.
Yeah, because I think we have spoken about this even for much lengthier times lah. But I kind of want to talk about, okay, since we are saying that these three people can work together, we got three separate individuals, right? What is like a situation that enables all three people to be part of a team for just one individual, let's say, right? So you're telling that, in my practice, I've actually seen that and had a bit of experience, and you have also in your line of work, I can see. So do you want to share yours, or shall I do mine?
Maybe you can share yours first.
In my practice, I had a case once where, still even ongoing, where the client had, we suspected substance-induced psychosis, but apparently it was schizophrenia. That's the disorder that people are hallucinating, the most common symptom that we talk about. And the client also seemed very depressive in mood, a lot. So when the client was brought forward to us, first thing was psychiatric intervention, which is where we call it medical assisted treatment, where the medication was dispensed to sort of control the symptoms better. And it also helps with delusions, doesn't help so much with the negative symptoms. I think we need to have another episode about talking about that. Yeah. So, but the negative symptoms were tackled more by the counsellor. In that case, it's me, to work on that. Also affected the person's self-esteem, the view of life, and general behavioural issues, coping skills as well. That was where I came in. Now, this at some point, because I also counsellor per se needs to also be able to identify possible issues. I noticed that there were maybe cognitive issues. So I wasn't sure if the client is unable to follow certain classes, or unable to maybe receive certain instructions and execute, because behaviorally there was a lot of inconsistencies, or is it really a behavioral issue? So that's when I enlisted the help of a clinical psychologist to do a IQ test, so that we can identify and hopefully identify. I want to say hopefully identify, because some people can also manipulate an assessment if they're really smart. But hopefully identify whether this person has any issues with their cognition. So in this particular example, which is a true example, all three practitioners got involved in this individual's treatment. So that was my personal example, and I kind of hope that sort of helps people understand that sometimes you need more individuals. Yeah. What about you, Brian? Have you had similar experiences?
Yeah, thank you, Kueh, for sharing about that. And I think the most important thing to talk about is this idea of a team that's working together.
Yeah.
So regardless of whatever condition, mental health, physical condition, right, it's not something that can be handled alone by a single profession. It's always about working together as a team. Like me personally, I have two major fields or major places where I'll be working like this in a team. I can share a little bit about just that in a special needs center.
Yeah.
In a special needs center, right, definitely it's not just about the counselor, psychiatrist, and the clinical psychologist as well. You also need special education teachers. You also need our fellow allied health professions, the occupational therapists and the speech therapists, which I believe this is something we can discuss in another podcast episode as well. And you know, me as a clinical psychologist, I help to assess the child's condition and also help to plan out this child's entire outlook. And I work together with an occupational therapist and a speech therapist, and also work together with the teachers as well to help to guide this child as well. But it's not just about the child as well. Sometimes the parents might be having some issues. Sometimes I might see them personally, or I can get a counselor to actually help out with their parental stress, and also maybe they are dealing with other things as well. Because special needs service in Malaysia is not cheap as well. This can cause some kind of financial stress as well. And of course, this child might require some kind of medical attention as well. Kids with autism or behavioral issues, conduct disorder, they might have some kind of emotional trauma that requires medication to help out as well, medication to intervene. So this is where I will probably get a developmental pediatrician or a child and adolescent psychiatrist involved. So that's one of the first settings that I would generally encounter a lot of different people. So there's a lot of different names here introduced as well. So we'll probably talk about that on another day.
Alright.
Then the other setting that I generally would encounter this is I also help out in pain clinic in one of the hospitals in Malaysia. So a pain clinic is something I think not many people hear about. But in that pain clinic, what we usually deal with is chronic pain conditions. Some of the common chronic pain conditions includes like osteoarthritis, rheumatoid arthritis. That's just some examples of them. I will deal with cases like migraines, headaches. But in this team, we actually work in a multidisciplinary manner as well. There's a clinical psychologist, there's also a pain specialist, there's also a physiotherapist, there's also an occupational therapist, and there's also our nurses, and this is how we work together in a team to actually, in a sense, holistically and help the patient in multifacets. Because a patient who is experiencing pain, you can't just take chronic pain, especially, you can't just take medication. You also need a physiotherapist to help them with their physical functioning. You also need an occupational therapist to help with their life functioning. You also need a clinical psychologist to help with their emotional and social functioning as well. So this is one of the other settings that I will commonly encounter a lot of different professions as well. And even a psychiatrist sometimes is involved, especially when we're dealing with a little bit more complex conditions. For example, chronic pain with some kind of severe mental disorder such as psychosis, or even like suicide ideation. Sometimes we might need the help where we will entrust and refer to a psychiatrist. So one thing that I also want to make clear here is about the idea of me using the word complex. I'm very careful about this word because complex doesn't mean severe. When I'm saying complex, I'm just referring to the fact that this patient or this client is dealing with multiple dimensions of concern. It's not just about the physical health, it could be also about the mental health, and there's a lot of different dimensions as well. Just because you're dealing with a lot of things doesn't mean it's severe per se. My personal definition of severe, or a clinical definition of severe that I like to use, is if this person is not able to survive on their own. Meaning to say, if you really put them out there without any additional help, without a support system, you'll be concerned about their well-being. So that's something that I just want to put it out there, because just because you're dealing with a lot of things doesn't really mean that you're severe, you're incurable, unrecoverable per se. And even people who are severe, that doesn't mean that it's the end of the world as well. You just need to find the appropriate team to help you with that, not just an individual.
I love the fact that you explain the difference between complex and severe, because complex is talking about, if I want to simplify it, we've got a lot of things happening. Severe is like, it could be a lot of things, or it could be one thing and that thing is bad. That thing is really bad, right? So in like your example, you actually brought up so many more different professions, and thank you for that. And I think we need to have an episode just on all these different relevant professions in our practices as a mental health practitioners, right? Some of them are not exactly mental health practitioners, like saying talking about a developmental pediatrician, but they somehow get involved. There's an overlap and all those kind of things. So that is something I think we need to explore more lah. Thank you so much for giving that example. I really hope our listeners, as of today, 30 plus for you guys, but as of today, I really hope that our listeners have, like, maybe even if they don't comprehend this whole idea of multidisciplinary practice and how the big three we always talk about sort of need each other in a way, that at least they'll sort of have an idea lah. And I think you really did a great explanation. So thank you so much, Brian, for covering all those things today.
My pleasure.
Yeah. Is there anything you'd like to add on based on like everything that we discussed today?
So yeah, I think as Khaled mentioned just now, I think we threw a lot of technical terms and clinical jargon. Always feel free to Google it, but I think just for kind of a very simple overview of a message about today's episode is mental health is a huge pillar that helps determine our quality of life. Okay, so when our mental well-being is affected, it also affects how we are physiologically as well, meaning our sleep. It can weaken our immune system and impact our relationships. Okay, so it's not just something that we can just put it aside and just leave it for later per se. It's something that we always have to take care ongoing. And I'm not saying you only take care of your mental health by seeing the big three as well. It also is about your general lifestyle of how you are taking care of your mental health. So what I want to highlight is mental health is a part of our universal human experience. It's something that we need to normalize. It's just like a heartbeat. Okay, it's just like our liver. Okay, it's something that everybody has. It's not something that's unique to Gen Zs, Gen Alphas, or whatsoever. It's something that everybody has.
Yeah. Okay, thank you so much, Brian. I think that highlighted why we need to give it a lot of attention. As you had mentioned earlier in the episode, the importance that we should be giving physical health. It needs to be somewhat in par and not one after the other. And it's something that we all have, and we don't take care of it. Eventually, it can become an illness, but we don't wait for it to become an illness for it to already be bad and for it to be addressed and given attention in our lives. So thank you so much, Brian, for joining us. Before we end the episode, Brian, could you share with us how our listeners could contact you for your services, and a bit about, if they contact you, what is it that you provide?
Okay, so once again, if you would like to just search me, you can always find Brian Kueh as in Kueh Tiao. Okay, alright, and then you can just search psychologist. So I primarily specialize more in special needs or child related matters and concerns. So, but I'm not exclusively only seeing children. I do also help to manage sometimes more general adult mental health cases, just the general life transition issues, or just any concerns with depression and anxiety as well. But of course, I primarily do a lot of child work as well, and it's not just about the clinical child work, such as things like autism, ADHD, but even like emotional turmoil and behavioral difficulties in children as well. And I do a lot of parent coaching as well as part of my work. So so if you like to just look for me, you can Google me, or you can search Blossom Bud Learning Center, which where I'm primarily practicing right now. So thanks for sharing, and thank you for the platform, Khaled.
My pleasure. I will put a link on Blossom Buds, and hopefully some other contact information of my colleague Brian here. Right, thank you so much for joining us, and this concludes our first episode. Thank you everyone for listening.